everybody, welcome back to my channel. I'm Kerstyn and thanks for coming back. Make sure you hit that subscribe button, give me a big thumbs up. Oh my goodness. So the month of May has been insane. The beginning of May, I started with my migraines again. So we thought that we fixed the migraines. Well, that wasn't the case. I ended up in the ER. They gave me the migraine concoction, which was tramadol, which was an NSAID, Benadryl, a nausea medication, so like Zofran, and there was one other medication. And they pumped me with fluids, and then they sent me home with the same thing. So I was off work for 2 weeks with that. And then Camden's birthday party came around, and my belly started feeling weird. Well, I've always had bowel issues. Yeah, you're gonna hear a little more about me than maybe you want to hear about me. So if you get a little queasy when it comes to bodily issues, functions, fluids, you might not want to watch this video. So the day of Camden's party, my belly started acting weird. I was bloated, I wasn't feeling well, which when I don't start feeling well with my belly, I just take a couple pills and then I have a bowel movement and there's no issue. Well, this time those pills didn't work. I just kept feeling bloated and my belly hurt. And well, needless to say, nothing worked. I always drink a gallon of water, I work out, nothing worked. So the next day comes around. I try to take pills again. It doesn't work. Well, I just kept going on with everyday life. Work, school, being a parent, kept going on, kept trucking along. Well, Friday comes along. I wake up at 3 o'clock in the morning. I have pain in my belly. I take ibuprofen. I don't think anything of it. And I drop Camden off at the babysitter's. I start feeling more pain. I'm like, oh, I'm probably just hungry. Don't think anything of it anymore. Well, I keep driving and the pain is getting more intense. And I'm like, oh my gosh, what is going on? Something's not right. Then I start feeling like I'm in labor. Like my belly is contracting. What? Why is my belly contracting? I literally feel like I'm in labor. And the only reason that I know what that feels like is because I had Camden. So like I literally feel like that I'm having a contraction and like it's not going away, and I'm not pregnant. I know that I'm not pregnant. There's no way that I'm pregnant. So I had extra tramadol in my bag. So I took that to see if that would subside. So I didn't know what was going on. And I'm driving down the strip. I'm getting closer to work and I'm thinking, well, I'm either going to work or I'm going to the emergency room. And I work at the hospital, so it's either one or the other. And I'm literally practically standing while I'm driving. I have no idea how I got to work safely. I'm literally driving, bawling, hoping that this pain stops because it's literally one contraction right after another, which is exactly what it felt like. I called my supervisor, which she's my age, and I knew that she worked that day. And I said to her, I'm like, I need help. I can't get out of the car. I'm in so much pain. I feel like I'm in labor. And she's like, what's going on? Like, she kept asking questions. She came to the car. She helped me get out of the car. She took me down to the ER, got me in the wheelchair. I went in. Oh my gosh, I did not want to get in a wheelchair. I'm 31 years old. So we go into the ER. They get me registered. I go in, do my blood work, blood pressure. Nobody's in the ER at all. So I'm the first patient. At least that's what it seemed like. I get taken back right away. And before I knew it, the nurse, the doctor came in right away. And they're like, what's going on? And I told them that the best way to describe this was, I feel like I'm in labor. I feel like my uterus is contracting. I have severe abdominal pain. Like, I don't know how to describe this other than I'm in labor. And it really hurts. And the doctor is pressing on my belly. And it's tender. And like, I know that he has to do it. And he's like, I'm so sorry. And I just keep thinking, I know you have to do this. I know you have to do this. Like, you do what you have to do. I'll get through it. You do it. You do you. And I'm just like, oh my gosh, what is going on? They're like, okay, we're going to go get you a CT. So I go back, get the CT, come out. And the nurse comes in and she's like, we're going to give you pain meds. And she gives me morphine. Morphine is a severe pain med. And literally, no lie, that was like one of the only pain meds that actually worked for me while I was in the ER. And before I knew it, shortly after she gave me the morphine, one of the surgeons came in. So he came in, sat down in front of me, and he just like shakes his head at me. And I just looked at him like, what's going on? He's like, you're young, you've had no abdominal surgeries. I've had a few surgeries, but nothing in my abdomen. No emergency surgeries, no nothing. And he's like, I can't believe what I'm reading on the CT. He said that it's reading that you have a closed loop bowel obstruction, which doesn't make any sense. I should not be having that, especially at my age. And it's showing that I have a lot of fecal impaction, which I'm thinking, oh dear Lord, like this is bad. This is really, really, really bad. And he's like, I don't believe what the radiologist is saying, so I am going down to the radiologist and reading it for myself to make sure this is what I'm seeing. So I just wanted to give you a brief overview of what I'm seeing. And he's like, if this is what we are seeing, you are going to need surgery. We're going to have to take you back and we're going to have to go in and take care of this and get rid of it and do everything that we need to do. I said, okay. So he gets up, goes out of the room, goes down to radiology. And I'm just freaking out because this is bad. This is really, 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 really bad. And I'm not gonna lie to you. My mind is like going to bad places. And being in nursing school, like knowing about this stuff, my mind, guys, is going to death. Like if this doesn't get taken care of, like my bowel could perforate, which like could like break open and like your poop could go into your bloodstream and like you could die. And like I just started crying and I called my mom and my mom's freaking out and me telling her that I'm probably going to need surgery and this is what the surgeon said. And well, I'm on the phone with my mom and she's at work, and then all of a sudden, I bet you not even 10 minutes later, a whole slew of doctors come in, which we all know that doctors travel in packs because like you have the residents, the interns, all of them travel together. So they all come in and they're saying that this is what's on the CT scan. Well, okay. So they're telling me this is what's happening. And this is a different doctor that's telling me what's going on. And she's saying, well, you might need an ostomy. Like what? So an ostomy is like where they pull like the bowel out. Like your intestine comes out of your body and they put a bag over it. And because if like it's as bad as they're saying that it is, my body needs to heal. So like What that really means is like your poop would like go into this bag outside of your body. And I'm just like, what? And she says that it would be temporary. And I'm just like, what? I'm thinking, no, you're not doing that. I'm 31 years old. You're not doing that. And she's like, I'm just telling you, like, worst case scenario, this is a possibility. This might happen. And I'm not gonna lie to you, I am more worried about that. My bowel being on the outside of my body, pooping into a bag. Because let me tell you something, out of everything through clinical, that grosses me out the most. The smell of it, depending on where it is in your colon, if it's on the ascending, transverse, or the descending colon, oh, the smell of it, oh, that is the smell that gets me the most. So I'm having a hard time with this. So they are going to prepare me for surgery. And the one surgeon actually did one test, which was, I kind of thought, a little odd. She comes over and pushes the stretcher that I'm on. And she's like, you didn't really wince too much when I pushed it, which is good because then we didn't need to rush you right away. So we could figure out how we were going to do this. So I get taken up to pre-op and I get prepared and ready to be taken back to surgery. So I get taken up, get surgery, come out, and no lie, the nurse tells me that the first thing I asked is if I have an ostomy bag. Thankfully, I did not have one. And I remember feeling my belly. Like, I felt my belly. Because I was so worried about it. I did not want to have it. I did not want to have that bag. But the nurse literally tells me that is the first thing that I asked. And he kind of got a kick out of it. So, here is what I was diagnosed with. I had Nicole's diverticulum, which is a small pouching in the intestine, which is actually developed during pregnancy. So way back when I was in my mom's womb, this was developed. It's actually kind of rare, which I'm a rare person apparently. So normally it doesn't cause an issue, but here it actually had stomach matter in it and it had blood in it. So here it was causing an issue. So that was taken care of, they fixed that. And the other thing was a sigmoid volvus. I think I'm saying that right. I haven't been saying that right the whole time. So the sigmoid volvus, hold on a second, is a portion of the intestine that has been twisting, and that is very rare. So the twisting is actually the contracting that I was feeling. So the feeling of me being in labor is the twisting of my sigmoid colon. So that twisting and untwisting, the contracting and uncontracting is what I was feeling, is my colon was twisting and untwisting. Oh my gosh. So it was actually a bowel obstruction. And they actually removed my sigmoid colon. So I no longer have my sigmoid colon. So I only have the ascending, transverse, and the descending colon. Because I actually had an extra portion of the intestine. So not only did I have the Nicole's diverticulum, the sigmoid colon was wacky. I had an extra portion of the intestine. And the sigmoid volvus is actually a very rare condition. And it is life-threatening. So the fact that I had the sigmoid volvus was bad. Very bad. Oh, and here's another weird thing. When I heard this, I'm like, this is weird. this is really weird. My intestines were floating. So in medical terminology, floating means not attached. So like your intestines are like attached to your body. Mine were not. Mine were just sitting there, not attached. Now they are, but it's just weird. So I had all of this going on inside of my body. And I'm just, wow. Like, it's crazy. So all of this was taken care of. I'll show you guys a picture of the scar with the staples, which that one's a picture. And then I'll actually show you a brief little video of what it looks like right now. It looks really good. My belly is still healing. It looks a little wacky, but when I came out of surgery, I actually felt like I had a C-section, which with Camden, I did not have a C-section. I had a vaginal birth. So I actually feel like I had a C-section because my belly felt like it was down in my pelvic area. So when I would get up and walk, I felt like my belly was down there and I actually had to hold my belly up. It was very, very weird. Very weird. I ended up spending 3 nights in the hospital. Oh, the pain was unbearable. Oxycodone did not work for me at all. They had to give me Dilaudid. So I was using Dilaudid through the IV and then alternating that with acetaminophen, which is Tylenol. I did not eat for the first 2 days, I believe, because I had no appetite or anything. And I was not able to leave the hospital until I had a bowel movement, which I was afraid to, especially with them being in there and stretching my intestines. And with being so fecally impacted, like they were stretching the intestines and getting all of it out. So I'm just like, this scares me. Which eventually, yeah, it happened. And it wasn't as scary as I thought it would be. And like walking and everything was hard to begin with. But I got there. Staples were very uncomfortable. So I could not wait to get them out. Thankfully, they came out about 10 days afterwards. But I'm still on restrictions. My surgery was May 27th. It is June 20th. So I'm almost a month out of my surgery. I have not been to work. I am not allowed to lift more than 10 pounds. No pushing, pulling, lifting until July 7th. I am allowed to return to work July 7th, which it's been nice. I've been able to work on schoolwork. I'm walking. I'm actually walking about over 3 miles, which is wonderful. I've been working on my weight loss, which is great, and I will update you guys on that, but that's another video. I've been doing good, but one thing that scares me is not having a bowel movement. I'm a little worried about my intestines, my bowels, everything moving great, because it's quite possible that I might have future surgeries. They told me that that's a possibility. I don't know that for sure, but I go to see a GI specialist in August. I'm currently taking stool softeners just to make sure that everything goes smoothly. And if I feel a little nervous that my bowels aren't moving, I can take Miralax, because that's not going to hurt me at all. But it just makes me nervous. It really, truly makes me nervous, because with everything that was going on internally, like, it's scary. It's very scary for me. I just don't want anything bad to happen, and I don't want to damage anything. And I don't want anything bad to happen again. And I knew something was wrong, but I kind of just blew it off and figured it would fix itself, because it normally does. But I'm just very thankful. I'm very, 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 very thankful that everything turned out the way it was. They were able to fix everything, and I'm still here. I'm I'm still here. They fixed it. I'm still here with my son. I'm able to return to clinicals. I'll be able to go to work. I'm able to continue to normal daily activities. But if anybody has like any questions about any, like the sigmoid volvus, the medullus diverticulum, I know, big medical words. If you have any other questions about anything, just let me know. I'll answer any of them. But okay, so I'm going to show you guys a picture of what my belly looked like right afterwards. So it's just, it kind of looks like a little hook. It goes down around my belly button and then down. And then I'll do a little video clip of what my belly looks like right now. And then we will end the video. That's all I have for you about my emergency surgery. Crazy, crazy, craziness, everybody. Craziness. Bye, everybody.